So we wanted to spend a few minutes on this panel to talk about a really exciting project that we're doing, and take this time to share, I think, some initial thoughts about a partnership track in our student and patient scholarship program. And it's a really exciting program that was co-developed with our patient leaders and our student leaders. And I wanted to co-moderate this panel with our student leader, Matt Erlendson.
Okay.
So Matt, if you want to say a few words.
Yeah, happy to. Thank you. I think I'd like to start just by talking a little about the word empathy. And I was actually very happy to see the social media analytics out in the main hall. That was actually the #1 word that was being trended in relation to the conference today. And this program has been all about empathy. And from the sense that we wanted to create a program with patients and students that encouraged empathy building through joint perspective taking. So what is it like from the perspective of a student? What is it like to learn about the life, intimately learn about the life of a patient? And what can students learn from that? And similarly, what can patients learn from students about healthcare and interacting with the healthcare system? And we truly believe that through these relationships, we can improve healthcare for everyone. So we have a brief video just to explain the program a little bit that was put together by the MedX staff that maybe we can show.
About to start my first chat with Charlie. I am just really excited to get to know them after reading their journal entries this past week.
So we know a little bit about each other based off of what we shared in there, but this will be the first time that we've really been able to talk face to face or video camera to video camera.
We spoke mostly again about his transition from female to male and that experience, while it also interacted with his narrative as a brain tumor survivor.
It was very opening to kind of have a partner who was very forthcoming with her situation and her story, which made it very easy for me to open up.
I think we have a lot in common. I think that it has turned into something that's more of a sort of like a mutual empathy building project.
Welcome to the world of someone with a long-term health condition, trying to put forward other ways of thinking about people on the receiving end of services. The reality is it can be really draining.
How important it is, I think, for our patient advocates, for them to really make sure to take care of themselves. And what I learned from Allison is that this kind of work is physically and emotionally exhausting.
There's just kind of one moment, I feel like, during our conversation that really highlighted my lack of awareness, is he was talking about using a binder.
Something like a binder that like a transmasculine person would wear to flatten their chest that can potentially cause broken ribs and then all these different things that would impact activities of daily living. But unless you knew about what a binder was, you would have no idea that that could be impacting their health.
And I thought he was referring to a school binder for about 5 minutes before I finally realized that I made a mistake based on the context.
I think this has been a very eye-opening project. To be able to get the insight from a patient with chronic disease about what their life is like, not just on a day-to-day basis, but then even as they reflect on how their life is different with the disease and what things and accommodations they have to be actively thinking about for themselves.
The biggest challenge I've had so far would be the sort of daily negotiation of who the self is and where my conception of my patient self fits in as a part of and not the whole of me.
I have really enjoyed the conversations I've been able to have with Galim. Concepts such as power and the difference between a patient who tells their story to working with that story to push for change. I've loved the fact that we've worked together on my other presentation. The presentation that I'm doing models the values of everyone included.
I did not know exactly what I was missing until this program. This program has revitalized my passion for medicine in a way that the medical program has not been able to do. To be able to follow our conversation over a longer period of time than just one clinical meeting has been, I think, paramount to my understanding of what it means to be a physician, what it means to be a patient, and how across the continuum of time that can change. And that change and that progression is what defines how medicine is run. So to me, a program like this is crucial, and I believe every single medical student has to be paired up in a similar program.
Today's physicians may be able to address the gaps in transgender healthcare access, but tomorrow's physicians will be able to close them.
Great. So we have some time now to explore this program a little bit. Matt, do you want to lead the discussion?
Sure thing. So just want to thank everyone here. It's been a pleasure working with everyone. And I'd just like to start, maybe have each of you introduce yourself, tell the audience a little bit about yourselves, and just start telling us by, what were your expectations for this program? What did you expect, and maybe what surprised you?
Oh, right, I should start. I'm Allison Cameron, and you'll have gathered from my accent I'm not local. I'm Scottish, and I live in central London. I didn't have very many expectations. I think I expected more barriers because we're from very different systems. But then, well, I should say a bit about me first of all. I graduated in Russian in the 1980s, and I worked on projects around Chernobyl. So I am radioactive as we speak. So do be careful. Seaweed's good for that, full of iodine. So anyway, I digress. Yes, and I lost all. When I have PTSD, my colleagues were killed in the course of my work. So I had this identity shift that I hear about from the very many patient advocates that have very different stories to myself that I meet in the course of my work. And just trying to put some very difficult experiences to good use. I didn't have these expectations particularly, but then I saw Ghalim's name, and so the empathy was not initially anything to do with him being a student and me being a labeled patient. I'm someone who studied in my first degree Russian studies, so basically anything to do with the former Soviet Union. So as soon as I saw Ghalim's name, I knew that there was a connection with Kazakhstan. So it's an important point that often empathy is about finding that other stuff that you have in common, that it's not necessarily as them and us as you might think. So we already had that connection, and the rest just flowed from there. So I think it was good not to have any expectations and just to let it develop. And as I said on that video, it's developed into something not just empathy, but inspiring, yes, but inspiring into action, in that we're having a practical result in the sense that we've sort of worked together, co-designing the session that we're doing. And that's a plug, by the way. That's 151, where we're doing that, and that's very satisfying. So thank you.
Hi, everyone. My name is Galam Imanbayev. I am a second-year medical student here at Stanford. And my expectations were, I think, very similar. I wasn't quite sure how not only was this relationship initially transnational, it was transgenerational. And so I didn't quite know, but the moment that in our first 5 minutes she told me she did a research project on a region of Kazakhstan where my family's tribe is from, that's when I realized either Matt and Medicine X are so good in finding the right people, or it's just, incredible luck. But I do want to give the rest of the panelists some time, so I'll just say that what I got a lot out of it was to know that as a medical student, you can have these relationships with a patient, and that is the natural approach to how to develop patient relationships. Waiting 2 years until you meet patients, or or you see standardized patients, or you see them just for half an hour, that's not the right way. And if you can do so earlier, that will be the fuel that can guide you through the more difficult parts of your medical education, whether it be clerkships, residencies, and so forth. So I come away with this very inspired, and I come away with this wanting to continue to work with Allison going forward.
My name is Alicia Staley. I'm one of the e-patient mentors. So I got to watch the process unfold, and I'll share my learnings for when we get into that. But go ahead.
I'm Allie. I'm a first-year student at USC in the Occupational Therapy Master's Program. I admit I had a bit of a leg up because I'd already seen some of Charlie's presentations at MedX in years past, so I kind of knew a little bit more of his story, but my only expectation was that I would really learn and grow a lot, and I was just very excited to get to know Charlie better.
I'm Charlie Blotner. Is this on? Yeah. Okay, it doesn't sound on. Sorry. I'm Charlie Blotner. I started my master's in social work at University of Washington in the fall. So I was the patient in our partnership here. And my patient narrative, I think, came from someone who has had awake brain surgery to remove a brain tumor, someone with epilepsy. But I found myself not really focusing on that in our interaction, because I thought that trans health and the gaps in trans healthcare as a transgender person were much more important to kind of address and to think about and talk about. And I think when it came to what I expected and what I hoped to get out of it, and if that happened or didn't happen, I think that I tried to go in with not really many expectations, because I knew that I would be talking to a student, someone working in healthcare, and or someone who wanted to work in healthcare, and I really wanted to to find out what her baseline was, and then to see if I could meet that, or where I could take that, and then just go from there.
Great. And for the students on the panel, if you could kind of distill your main takeaway, if you could say, this is one thing that I want to take forward, it's going to change the way that I am going to practice healthcare in the future when I see patients. What do you think that might be?
I can start. I think that my main takeaway, while I had so many lessons that I learned personally, the biggest thing that's going to impact my practice is that realization that I would never go into a patient's room to see them clinically if I didn't understand their diagnosis and the precautions that might involve. And equally as important is maybe understanding and taking the time to research and educate myself on their social, cultural background. Because as we've been talking about so much this weekend, our patients are so much more than their diagnosis. They bring so many other identities and values and things that they care about to the table and the roles that they're involved in. And I think if we're going to meet patients in a partnership, they know about us, as they're coming in, they understand who we are as clinicians and maybe have done some research on us. If we're going to meet them there and really partner equally, we should take the time to know a little bit about them, not just their patient story, but their overall story. So whatever that might look like, and not asking of them to be the educators in that situation, not putting that responsibility on them, because they're already going through a tough time, especially if they're working with occupational therapists, because we usually meet patients at the tertiary and quaternary stages of care, where it is not just a checkup visit, like a diagnosis has been made, an issue has been identified. And so not putting that burden on them, but shouldering some of that ourselves, and really educating ourselves and meeting them as much as possible where they're at.
So for me, I would say that my initial conclusion, which then had to be edited, my initial conclusion was to say that I would love to have a similar deep relationship with all of my patients. But going through some clerkships, you begin to realize that is just simply logistically very difficult to do. So then I thought, what can I take away from this that could be realistic within the current framework, but also at the same time find a way to challenge the current framework as well. And so what I'm taking away from this is to say, if there are patients out there who are raising their hands and are saying, we want our voices to be heard and we want us to be part of the decision-making process, then with those select folks, then you empower them and you equip them and you put them in positions of influence that aren't just for a nice narrative, but are for a decision-making process where they're viewed as equally as everyone included. So I think for me, it's more about selection. I know that I can't do the same with every patient, but when there is a patient, it would be simply immoral for us not to equip and support that effort.
And similarly for the patients here, what is something that your takeaway from your experience working with an upcoming healthcare professional student? Is there anything that you take away from that experience that maybe changes your view of healthcare or how you might interact with the healthcare system in the future?
This kind of confirms what I already kind of talk about in my work, but I've tended to talk about it from largely a theoretical base that I feel in my gut, as this is fundamentally about a new kind of relationship between patients and healthcare professionals. It is, but I had this theoretical base, but didn't have. While I do it naturally, I sort of keep contact with the students that I work with when I deliver lectures to students at Imperial, for example. This is the first time it's been actually embedded into a program, and I think this is really, really key. And yet again, what I've had confirmed is it's not enough for me to go around demanding, because I'm known to be very demanding, that professionals walk in my shoes. It is equally essential that I walk in theirs. And that includes students, but we very rarely have the opportunity to have a safe enough space to start exploring some of that quite difficult stuff. So, it was great to have it confirmed that despite even the different systems and geography and generation and all of that, it is still absolutely possible to build the kind of reciprocal relationship of equals that we really need to have as the norm in the system, rather than the traditional parent-child dynamic of the past.
Right. And I think on that note of equals, or what I guess I previously assumed to be equals, I think that we oftentimes talk about hierarchies in healthcare in the context of patients and physicians. But I'd never really considered the hierarchies within medical education before. And so with talking with Allie and talking about her experiences, I kind of became attuned to how, what if your higher up is treating a patient and you're learning from them, and you realize that the treatment method that they're using is outdated in a sense, based off of literature, research that you just read last week, and you're learning about it in the classroom because you're the current student. But they don't have time, to always keep up with all this research and everything, because they're always on the go treating patients. And how do you kind of navigate this hierarchy of, I want to introduce this information to them, I want to kind of offer up this new suggestion, but also I know that this is the person who's going to be writing my letters of recommendation. This is the person who is in charge of me in front of the rest of my classmates, and kind of trying to figure out how do you introduce a question or an opinion that circumnavigates this hierarchy, and do so safely, in a sense. So that was something that I hadn't thought about before, that was probably like one of my biggest takeaways.
Is this accurate?
Yeah, so I think what we probably should wrap up soon, but maybe what we can do is have the last question for Alicia, our e-patient coordinator, because we are giving some thought to the fall, to our next round of patients and students who are going to go through this this program. And as we're giving thought to how we can do this again, what are some thoughts going through your mind on what we can do differently or better?
I think this program in and of itself is almost a microcosm of what how the program can continue to build out, because the thing from listening to all of you and just knowing what I know about the program, and I think Allison, you spoke to it earlier, the idea that as patient advocates coming into the room, we've historically have demanded respect, we've demanded empathy, we've demanded, as advocates and patients, we have to also be empathetic, be respectful of the other side of the equation. And I think that these interactions and the way this program is structured, the patients and the students have the opportunity to understand both sides of this dynamic in ways that other interactions in the healthcare system don't allow for this to unfold. So the critical piece of this learning, if you will, is that empathy and respect have to go both ways in order for this relationship to build. And I think learning with the next generation of medical students and medical leaders is key for advocates at all levels, for having this opportunity to reset and be reminded of how important the basics of relationship building and respect are to moving forward in healthcare. We cannot have true healthcare reform change without a level set on the core fundamental relationship. And I applaud all of you for the work that you did in this program. It was really amazing, and I hope in the fall we have the opportunity to continue to build on this.
And we will have the opportunity in the fall. Applications are now open on our website. I encourage you to go to medicinex.stanford.edu. Look for our applications. We're looking for patients, we're looking for students, all healthcare students to apply. Applications are open until May 15th. So please apply. Please give a round of applause to our panel, to our student and e-patient leaders.